Okay, we are back. This is not a weather report.
Well, it's getting ready to be. It's getting ready to be. What's this?
That's your tie.
Okay, what's it got on it?
Yeah, and that's why I'm sneezing. I think my allergies is coming from your tie.
Now,
your tie's in full bloom.
You guys look me square in the eyeball here.
All right.
I put on a spring tie this morning. This is Jane bought me this tie years ago. It's some fancy designer, and I pulled it out last night. I said, I'm not wearing my whale tie. I'm going to wear this because it's snowing out there right now.
Yeah, right? We know.
Yesterday, we had a spring rain. We had, 2 inches maybe
right.
or more rain, and everybody been complaining that not enough rain this last week because all the blooming is coming. See, the ground up here believes that it's springtime because those little yellow flowers, what do you call those things, daffodils or whatever they are, popped up out of the ground everywhere. People are talking about it. And that's number one. Number two, Dr. Whaley and his wife tomorrow are going to take a couple days off. We're going to a place 20 miles from here and stay in a place, but it's going to be 65 degrees. You remember, I don't play golf. I don't shoot sporting clays. I don't do squat unless it gets to 60. So that means that Dr. Whaley and Mrs. Whaley can either take a walk, go shoot sporting clays, or mess up a golf course. On Sunday, it's going to be pretty. That's springtime in the mountains. Snow one day and flowers and playing golf.
But we're still in February. But let me ask you a question.
Yeah.
Are we already dealing in allergy season?
Oh, yeah. It started last week.
Did it?
The pollen count.
Okay, thank you, because I needed an answer.
I took one this morning. I took my Claritin this morning. The pollen count is officially high when it hits 125.
Okay, this is
Now, we get 4,000 or 5,000 later, but it was 250 last week.
Now, this is an Ask the Doc segment, so let's do this before we get into the questions. I take a daily allergy pill. Yeah. Is that okay?
Yes, but it's a little bit like let's say you're taking Claritin, over-the-counter Claritin, Loratadine. It's cheap if you buy it at the Costco or the
right, I get a bottle, 500, and it's...
Yeah. Okay, it's cheap. Now, it'll work great for 18, 24 months, and all of a sudden say, this stuff ain't working too good. Well, sitting right beside it is the generic Allegra or the generic Zyrtec. You go grab the other one, and it's going to work for 18 or 24 months, and then it's going to stop working. And then you go to the third one, and it's going to work for 18 to 24 months, and it's going to stop working. And then you go back to the first one, and that is actually the way it works. So I do pretty good with Claritin because I don't take it every day of my life. But I live with a woman who's got this year round, and she should take one every day, and she's got all three in the box there. She got the Zyrtec, the Allegra, and the Claritin. I don't know how she adjusts them, but you would expect that if you're taking something every day, month in, month out, 18 months, 24 months later, you got to change.
Well, I'm going to blame it on you.
It is.
I'm going to go ahead and blame it on you. No, I'm going to blame it on you because one time I said I could not be around a cat, and you said take an allergy pill.
I did.
And
yeah, you can be around a cat.
And now I have a cat, and my wife said one day, Dr. Whaley said you could take an allergy pill.
All right.
So it still works on the cat. Okay. So moving right along.
All right, let's get to Dr. Tidman. I don't know exactly what he's doing down there, but I know he's not but 40 miles outside of Atlanta, down south, down the highway down there. Okay. Between Atlanta and Augusta there's a big Ritz-Carlton there, and the golf courses there. Now, I don't think he plays golf, but I think he lets him massage his wife, and he sits out on the patio and he reads his book and stuff. And the weather was beautiful yesterday until it started raining. So maybe, I don't know, he'll be back for next week, I'm sure. He's not on his boat down in south, wherever that is. I know that.
You know, and he's got the day off. We'll go with that. I'm okay with that. You deservingly are going to take a couple days off. I'm happy.
Well, not a couple days off. It's a weekend. I'll be right back in the saddle on next week, though.
Don't be late Monday.
Yeah, but Friday I won't be here. Where am I going to be?
I don't know.
Mandatory training for municipal, state, and county elected officials.
Oh, okay.
Mandatory.
Oh,
3 whole days of mandatory at the University of Georgia, all day, every day, on sunshine laws and zoning and stuff.
Oh, audience, we at his young age, we'll say that for our audience that's been here, for his young age, he went ahead and started another career. So God bless you, and we appreciate you for doing that.
All right.
Thank you for your willingness to serve, and we'll leave it there.
Yeah,
we appreciate
all right.
that.
I did Vietnam 50 years ago. Now I'm doing Vietnam all over again in Vietnam. All right, listen.
Georgia Cancer Specialist, Northside Hospital Cancer Institute. Thank you every Friday morning. So
we have got a great question this morning that Ray would have had a lot to say about it.
Okay.
About iron deficiency. And as I was putting this together and listening to my staff, comes in and out when I'm doing this, I learned that there is so much misinformation about iron therapy and anemia. Even some of the, not my nurses, the oncology nurses, but let's say the people that are checking people in and out, the business office people, they're around medicine all the time. Some of these myths are actually in the doctor's office. So let's listen to this. You have discussed iron deficiency many times. I mean, we're always talking about getting an upper lower GI. If you're iron deficient, you have to be bleeding, right? We've talked about this all the time. And the need for a workup and the need to find out and document the cause. My question is about how to give the iron, okay? We haven't discussed that much, have we? We've discussed iron deficiency, and you got to figure out why you're iron deficient, but not how to give the iron. My wife has been treated for 4 years by her GYN with iron pills for every menstrual period. So, okay, that's why she's iron deficient, is female blood loss and not, colon cancer or ulcer or something. My wife has had fatigue and felt lousy for all 4 years. 6 weeks ago, a hematologist gave her IV iron for replacement. Her hemoglobin was 12, so she was not significantly anemic, and the GYN was still telling her to take iron pills. You got that?
Mm-hmm.
2 weeks after the first iron infusion, my wife is back to running 4 miles 5 days a week and playing competitive tennis. So it's 2 weeks after IV iron, and she feels good. For 4 years, she's felt lousy. This sounds like malpractice to me. What do you think? Interesting, isn't it? Well, first of all, I'll tell you, it is not malpractice, okay? It is the standard therapy of standard physicians for iron to think about pills instead of iron by vein, because it's cheap, easy, and it doesn't require a referral. I want you to show that first picture. I've got a great story here that I'm going to tell. And the first picture, what is that? That looks like a female athlete, doesn't it?
Yes.
Everybody got a good chance to look at that female athlete, and that's a real athlete there. Take that picture down. It is November, December 1995. The Olympics are summer 1996. So the Olympic trials for the Olympics are usually held 6 to 8 weeks before the Olympics, so that, if there's somebody that's injured, and you can't pick them in November, December, because they might get injured and not be available. So in November, December, they're training like crazy. I walk into my examining room in Atlanta one day, and sitting on my examining room table is not that girl, but a girl that looks just like it, and she's wearing a University of Oregon tracksuit, and she is as hard as a rock and lean as can be, and her complaint is, my training time in the 10K is 20 seconds slower than it ought to be. So you're talking about a 6.2 mile run, and her complaint is 20 seconds.
This athlete, you walked in, this athlete
knows what she should be doing. Remember,
Yes.
I've always said I had a chance to treat the biggest guys in basketball and the biggest guys in hockey, and the difference between Michael Jordan and the rest of the NBA, I've always said, is 1/10 of a second and less than an inch, because they're all fine-tuned. So I said, well, how'd you get here? She said, well, I'm training in Leadville, Colorado. That's at 12,000 feet. You remember that they can get oxygen up there. And I've been through the sports medicine clinic at the University of Oregon. That's where Prefontaine ran. That is the top track school in the nation. And she's now at the Olympic Village in Leadville, Colorado. And she's been looked at by the Olympic doctors, and they can't come up with anything. And she said, I'm on my way to a meet at the University of Florida, and I was talking to one of my coaches, and my plane changed in Atlanta. And I said, well, and he told me to just book an 8-hour layover here and make an appointment to see you and then go on down to Florida. So I said, one of your coaches? I said, who was it? She said, well, he's an old guy. He says he used to run with you and that you know about this, and he trained at the University of Florida. Put up that next picture. Who's that?
I can't
That's
see.
the cover of what?
Sports Illustrated
magazine.
Right.
And the headline says, next stop, Montreal. What's the shirt say on it?
Florida.
That is the top guy at the time, won the gold medal at the 1972 Olympics, and we'll just leave it out since that's would be a violation of a confidence, but everybody knew Frank Shorter.
Okay.
Frank Shorter. Well, Frank Shorter's the old guy who told us stop in Atlanta.
So this is the old guy that said, I want you to make an appointment with Dr. Whaley.
That's him. So
okay.
I got her records there, and they have tested her for everything. They've tested her for chronic fatigue. They've tested her for mono. They've tested her for thyroid. But what have they not done?
Iron.
They've not tested her iron. Show the next one. Okay, this article on iron and endurance athletes highlights, is it up there long enough for people to see it? Pull it off so they don't spend their time looking at it all day. You can have iron deficiency and not be anemic. And BKP has heard me use this analogy many times. God protects us from adverse influences so that if we're cold, we shiver. If we're hot, we sweat.
Right.
Now, oxygen is important to your brain, your heart, and your liver, and the chemical in blood that carries oxygen is called hemoglobin, and it is an iron-dependent protein. God stores iron in your bone marrow, your liver, and your spleen, and before you can become anemic, your storage iron has to be gone. Well, the biggest storage iron is the red pigment in muscle, which is called myoglobin. So you can have a normal blood count and be right teetering on the edge of the blood count falling, but your iron stores are gone. So the myoglobin in your muscle's not right. Well, you probably as a regular person wouldn't know anything except you say, maybe I'm a little off. An Olympic world-class runner can tell, I'm at this level of training, my time should be something right under 30 minutes, and 20 seconds ain't much out of 30 minutes, but they know it here and they know it here. So I said, look, the only thing I can think of is that you're iron depleted. It takes 2 days to get this test done. Go on down to Florida,
yeah.
But rebook an overnight stay here in Atlanta on your way back. Now I may not be able to do you any good, but if you're iron deficient, I'll give you iron in my office when you get here, and it'll take a few hours, and you'll arrive here around noon, so you'll get finished late in the afternoon. Just spend the night and go up the next day. She was iron deficient. I gave her a dose of IV iron. I arranged for her to get another dose of IV iron 2 weeks later from a colleague of mine in Denver. And she sent me before the days of text messages, but she sent me an email 4 weeks later when she qualified for the 10K in the Olympics, and her time was 32 seconds better than it had been when she came in.
She figured that 20 seconds out, or you helped her figure that 20 seconds.
Yeah, and plus another 12.
Interesting.
Okay, so you have iron deficiency without anemia, and people feel bad. Well, most often that's never even diagnosed, because you have to get anemic before your GYN or your family doc tests it. Now, back about the late 60s, there was a study done to figure out how much iron in storage does a normal person have. So if you want to do a study, you pay a medical student $10 and they'll let you draw blood off until he gets anemic, or a nursing student, or you do it in the military people. So this was done at the University of Texas, and it was done with male recruits at, I forgot what military base, and nursing students. So yeah, you got males and females of the same age, and the men could have 3.5 liters of, bottles of blood drawn off, like you were donating blood, before they got iron deficient. And 65% of the women became iron deficient with 1 bottle of blood drawn off. So adolescent and young adult women with menstrual cycles are standing right at the edge of iron deficiency. Now, if you're an athlete, then you'll find it. And if you have a little bit more than normal blood loss, you're already iron deficient. Okay, put up the algorithm. I got to have an algorithm for BKP. We're not going to spend any time on this, but when you look at this, it says adults with iron deficiency. Now, is it a life-threatening? You don't transfuse, or is it symptomatic, and then are you anemic or not anemic? Okay, pull that down, because that's iron deficiency alone. Just to show, put the next one up. This was going to be Ray's chance, because this is the way you figure out how iron deficient is somebody and how much should you give, done in a chart, so you don't have to make any. You don't have to get your slide rule out or get your computer, your calculator out. All right, put the next one up there. I always like to show this, because everything in medicine, we've got different people's names on stuff.
Right.
We were talking about Hashimoto's thyroid here a few weeks ago.
Yes, we did.
Okay, this guy Ganzoni, he's not an Irishman, is he?
No.
Okay, he was an Italian way back. I don't know. He was working he was in the Italian side of Switzerland, and he came up with a formula that you could do with your pencil and your paper. How many pounds do you weigh? How much is your blood count off from what it ought to be? And then this, you could with a number, you say, how many milligrams of iron do you have to get fit back to normal? So pull that down. So that historically, I think you told me a personal story about somebody in your family who was anemic in the 60s or 70s, and iron deficient, and the doctor said eat liver.
I'll never forget the doctor recommending to my mom for my sister to eat liver.
Okay,
yes.
Well that is a good source of dietary iron.
You know why I'll never forget it?
Because it tastes so bad you didn't
she
like it.
She put it on the kitchen table,
and we had to eat it
because. And I'm looking over at my sister. You're the reason we have to eat.
And I love liver and onions.
My dad. Oh God, don't give me. Let's not go there. My dad loved liver. So.
All right. Well, the issue is you can only absorb a certain amount of iron per day. Pull that next one up. Now, first of all, see, it says oral iron absorption test, a simple test with relevance in the clinical setting. Pull that down now. 25 milligrams, 18 to 25 milligrams of iron is the maximum amount that can be absorbed by mouth per day, regardless of how you take it. Normal blood loss for a woman having menstrual cycles that are 4 days in duration and of average blood flow is 18 milligrams of elemental iron per day. So she's right at that point where 18 to 25, she could become borderline iron deficient, meaning that she's iron deficient but not anemic, right? So show up the next one. So in anemic women, here's a way, an attempt to try and maximize absorption of women where they can only absorb us at 18 to 25 milligrams per day. So this test here says alternate days rather than consecutive day dosing. That means they double up the dose and give it every other day, and then see if you can kind of overwhelm the absorption mechanism with a trick like that. The answer is maybe up 2 or 3%. So it doesn't really work terribly well. All right. So what did we do for this woman at the Olympic athlete? I gave her IV iron infusions. She was not anemic, remember. She was iron deficient but not anemic. Well, this patient right here that we're talking about has a hemoglobin of 12. That is at the lower limit of normal for women. So she is not significantly anemic, and she responded dramatically to IV iron, right? So put up that next one. IV iron
Anemic and deficient
are different. Okay.
Very clear.
All right. And one more thing. Iron deficiency is not a diagnosis, right? Why not? Fever is not a diagnosis, right? If you've got a fever, you got to figure out why. So if you're iron deficient, you have to figure out why.
Right.
So if it's a male, it's going to be an ulcer or colon cancer or something. And in a woman, she probably had a GI workup because she was doing so, this is going on for 4 years. But for women in childbearing years, it is most frequently menstrual cycles and several pregnancies. But you still have to rule out, particularly if you're not, whether or not they do or do not have pathology in their GI tract. So if they're 40 years old or older, even if they're having heavy menstrual cycles, we generally get them a GI workup. Okay, put the next one out there. So this is really simple. This just shows this patient laying in the room there. You see you got a little needle stuck in there. Pull the next one down. This is the Injectifer. I'm not doing a TV ad here. I'm mad at insurance. Injectifer is the primary best product for IV iron because it has the lowest number of infusion reactions. You can pull that down. Infusion reaction meaning I run a little fever or I get a little chill or something, and it can be given over the shortest period of time. So instead of staying in the office 4 hours to get a long-term infusion, this can be administered in less than an hour. January 1, 2022, what's that, 5 weeks ago, every insurance company stopped approving that as the first iron and went back to an older iron preparation that takes 4 hours, has more infusion reactions, and therefore is not as easy to give to the patient. Now, why would 6 different automobile manufacturers do the same thing at the same time? They got to raise the price 5% or whatever they do. It's got to be collusion, right? Well, when every insurance company did it all together, you got to say those insurance companies are working with one another, right? Well, guess who pays for this infusion now? Medicare and Medicaid. Lord have mercy. We always talk about Medicare. Medicaid won't let you do anything. And right now, Medicare is doing better for iron deficiency than Blue Cross or any other insurance company.
Okay.
Now, the end of the question is this malpractice? And the answer is no. Should the GYN have sent her to, let me get that thing there. I'm about to choke myself to death with my fancy tie here. Should the GYN have sent her to a hematologist earlier? And I would say no. The standard of teaching following the cookbook is if you're iron deficient, your blood count's not too low, you got an answer for it, iron pills is the way. Now, this happened to be a very fit woman who knew she wasn't quite right, and it doesn't say, but she went to a hematologist, and I'm pretty sure she sent herself to a hematologist. The GYN did not, because the question says the GYN still wanted her to take pills, but she got an iron infusion. So she did just like that athlete before the '96 Olympics, sent by Frank Shorter. Thank you, Frank. I actually did run with Frank Shorter and Don Cardung and all those guys back in the day. And so there's no malpractice here. There was nothing done wrong here. And your wife just happens to be a special case, and she should have been treated with IV iron. There.
All right. Thank you, Georgia Cancer Specialist, affiliated with Northside Hospital Cancer Center. We always appreciate them for bringing these questions every week. So we have our second question.
Yeah, but Ray would have loved it. That's a PCP question, isn't it?
Well, here's what I was thinking the same thing during that question. This is a general practitioner.
That's a primary care.
That's
question.
A primary care.
And and you notice that the green room people were perking up over there when I was talking about the difference between, the standard is to give the pill.
Right.
But let's say you're pretty anemic. It would take at 25 milligrams a day to absorb a gram, 1,000 milligrams. So that is going to take you many months, right? If you're continuing to lose a little bit of iron along, whereas this can be done in either one infusion or 2 infusions a week apart. And then boom, you got all this stuff in there and it's gone back to your liver, your lung, your heart, and your muscle, and shoot, it's over with unless you start bleeding again.
And they're perking up.
They're perking up. All right, let's go to the next question. This is a redo. We had this question. We talked about this patient, I'd say 18 months to 2 years ago, because I went back. Some of this question doesn't put everything in it that was in the first time it was asked.
Right.
So I went and got the first one out and I read it again. My father has a very advanced cancer of the neck with almost a cauliflower-looking bleeding tumor causing severe pain and anemia. You remember this case?
I do think I remember.
His bones were involved and he was on high doses of short and long-acting morphine. He got better fast, and you discussed his case about 22 months ago when he had started responding, period. Okay, I went back and dug it out. This patient had a skin cancer called Merkel cell cancer.
Yes.
And it was in his neck,
yes.
And that thing was as big around as a cauliflower. You remember that?
I remember Merkel cell cancer.
All right.
And being on the show.
All right. And so when he had started responding, well, he was responding to an immune therapy. Remember, like the Jimmy Carter drug?
Right.
And not chemo and not radiation. And I said then, this is a rapidly progressive, often fatal disease historically. And that these new checkpoint inhibitors have totally turned this disease around. So we're going to talk about that again here in a minute. All right, the oncologist is wanting to stop his treatments now and monitor them. So he's had 2 years of treatments, and he's been in remission for 18 months. So he's been continuing to get the immunotherapy without any detectable disease for a year and a half. Okay? If you don't remember, he's now 83 years old. Well, I dug it back out, and he was 81 years old when the question was first asked. And he has 5 heart stents. And he is on treatment for congestive heart failure. And his swelling is controlled, and he has no chest pain. So what he's told us here is this man has comorbid diseases that make him fragile. He had a bad cancer and was in pain, and now he's totally normal. And he's having to go to the doctor's office every 3 weeks or 4 weeks to continue to receive this drug. And the oncologist says, let's stop and see what happens. What do I think he should do? Okay, put up that next slide there. This is just a quick.
Well, let me just say this. He was 81 when we got the question. Originally, he's 83. He's still with us.
Yeah.
So God bless it. He's still with us.
And he has no disease now.
Right.
And he's off morphine.
So
he's up and around. Okay. And he has no detectable disease, and it was eating up his bones. Remember?
Right.
Okay. Just to refresh your memory, put that first one up. Merkel cells are little bitty cells, and these are very interesting because this is a very unusual cancer. These are at the base of your hair follicle. Anywhere, you got hair here and everywhere else. We shave ours. I haven't got much. Me and you haven't got much either, but some of these guys are hairy. But it's this cell that picks up when you touch a hair, your brain can feel it. If you go up here and do like this, I'm touching the hair, right? I'm touching the hair, but my brain feels it. It's the Merkel cell that picks up that pressure on the hair root and transmits it to the brain. Okay, pull that down. Now, this tumor here, you see this little glistening little thing here? Mm-hmm. That looks like the basal cells from last week. That looks like the squamous. That looks like about just every little tumor we've seen. We even had melanomas that look like that, right? Little tiny thing here. But generally, they begin with a nodule like this. They are almost always on the sun-exposed areas of the skin, and they occur much more commonly in men than in women. And if you get it when it's like that, instead of ignoring it, this is another PCP question, if that patient was in Ray's office, you know what he's going to do, don't you? He's going to call around the corner there to the dermatologist and send the guy over there and get that thing biopsied.
Yeah.
We'll put this next one up. We used this picture before because the tumor on that guy that he was talking about was way too ugly. All right, this is what happens. That's the nose there. See, it totally destroys that nose, and that is an advanced tumor. You see, he's got a tube in his mouth there, and they're getting ready to do some big-time surgery there. All right, put the next one up and just throw it out. This is a bad one that actually took the arm off. Pull it down. So this can be a very destructive tumor. You don't have to.
Well, let me say something here. Let me stop you just for a second, folks at home. Let me just say this at home, okay? If you're new to the show and you found us for the first time, during this segment, Dr. Whaley makes sure that he thoroughly explains what could, what has, and what happens. So sometimes the graphics
are a little much.
I won't say they're
sometimes they're.
But let me tell you something. It goes with the question we're trying to answer,
right?
And it clarifies some things. So sometimes, folks, some of the graphics, but when we answer questions, when Dr. Whaley answers questions, we answer them.
We answer them. Okay, so the point of that one was that it can be so terribly destructive.
Yes.
And this guy we were talking about, 81 years old, was in agony and on long-acting and short-acting morphine. Was, as I recall from the first one, he was badly anemic, and we had a picture of this great big tumor. It's gone. So that shows how destructive it can be. So the next, you got to have a survival curve for BKP, right? All right, so here's your survival curve. You see how bad that looks at the bottom?
Mm-hmm.
Almost 75% of these tumors at diagnosis are in that advanced stage because they've been ignored. Pull that down. Now that has totally changed now. Because of what? Checkpoint inhibitors, new therapy. For you could say the Jimmy Carter drug.
I was just getting ready to say. Let me guess, the Jimmy Carter
drugs. Yeah, you remember like the Lance Armstrong
right.
shots, keep your blood count up.
The Jimmy Carter
drugs.
Right.
Okay, so put this up here. This just says triple immunotherapy. This man got single immunotherapy 2 years ago, right?
Mm-hmm.
Well, now
yes.
We got triple immunotherapy, which even you can pull that down now. He got a response in 8 weeks, as I recall from the original question, and in 6 months had no evidence of disease. Well, triple therapy will get you there even faster, so it's got a lot better long-term response. All right, so let's just, for the sake of advertising, here's the Jimmy Carter drug that he takes. They just told us what it was, and its brand name is Venencio, and this is, pull it down now. That's like the difference between Wrigley's Spearmint and Dentine and everything else. Those checkpoint inhibitors are all roughly the same. And so the Jimmy Carter drug and Nevo and some of the others would have done just as well for this guy. And my advice is 2 years of treatment and he's in a complete remission. The standard of care is to stop and watch, because you can always go back. And particularly for a man who's got congestive heart failure, stents in his heart, you're going to simplify his life dramatically by not making him go to the doctor every 2 or 4 weeks to get infused and get blood counts all the time. So he had a good response, and let the doctor watch him.
I'm just thankful. I mean, it's something about this question. I'm just thankful that 2 years ago, you and I, maybe here or maybe at Sycamore Crossing.
That was at Sycamore Crossing.
Was it?
I remember very
Was
well.
it? So, because that's our spring and summer home, and you and I, I'm just really. It means a lot to me that we've got this second question, but he's still with us 2 years later. 83. God bless you. Thank you for those questions. Thank you, Georgia Cancer Specialist affiliated with Northside Cancer Institute. You have your screen up. That means one thing. He's going to show us.
I know. We're getting to that in a minute.
We're getting to that in a minute. I see the screen.
All right. Now, you know that, first of all, last week I was saying there's so many things in the news that not COVID related that made me happy. I think there was one in there about a food recall for something that was in lettuce. I said, you remember when we were doing food recalls and Zika? Remember how big a deal Zika was? Remember the year before that it was H1N1 flu?
I mean, actually remember, this is fun. This is actually funny. I remember when the world was like, what will happen, Zika, and you and I were doing Zika updates, and we were talking about stagnant water. And
we're talking about pregnant women going on cruises.
Right, everything.
Everything. And then we had that H1N1 thing,
yes.
And I remember people up in Blue Ridge were just going nuts over H1N1. It just sounded so nice to say. But anyway.
I remember when life was simple and we was telling people to wash their lettuce before they...
Right.
Remember?
Yeah, and if it came in a package...
No, seriously.
If it came in a package from the store, don't think you can open it and use it without washing that one too. I mean, it's amazing, isn't it? We've come a long way. All right, so last week we had things about food recalls. So there's two things that are the first one that says be wary of influencers.
Can I read that? Because I can see, folks, we won't go into great detail, but I don't have my nears, my bifocals this morning.
You can read that without
right.
glasses.
I call them my far away and my nears, but I was over here. I want to read this one. Be wary of influencers giving health, fitness advice experts. Be wary of them. Thank you for reading that. Let me read
that's
that.
Us.
Well, but no, be careful of influencers. No, be careful. I know people that is like, please, I hope you're not, that's not the advice you're taking.
Okay, a great deal, I'm going to stick with this just a minute. A great deal of what we are seeing that is out there about the vaccine is going to track you because it's got nanoparticles in it and all of that, we know for a fact is coming from Russian, Ukrainian, and Chinese and Iranian website drivers. I mean, you know about website drivers. I don't know what it is. But anyway, I just wanted to get to that because the second one here, to me, is an absolute political statement that is clearly got an agenda, and this is coming from us. For this coming from Dr. Fauci and this part. This isn't coming from Russia. It ain't coming from Iran.
All right.
What's it say?
Which one's this?
That's this one.
About 73% of U.S. estimated to be immune to Omicron variant.
Now, what does that tell you? Last week, they were talking about the national immunization thing was at 50-something%, and you had all these people that weren't getting immunized, and you got to go get your fourth shot, third shot, fourth shot, all that sort of business. And then 1 week later, they're telling you that 3/4 of the population is immune to COVID. It says Omicron variant. Well, the shot you're taking isn't to Omicron, it's to the COVID envelope itself, right?
Right.
So you've got the Delta variant, the Beta variant, now you got the Omicron variant. The Greek alphabet's about used up, isn't it?
Yes.
And we know that immunization shot, the first round of shots for the variant itself, didn't do a darn thing for Delta, did it?
No.
Delta was sick. Delta killed a bunch of
Right.
people. Well, Delta made some people immune. The shot made some people immune. Now, Omicron's making some people immune. I'm going to look me right square in the eyeball, people. I have had 6 patients this week in my practice. 6 not immunized who had not previously had COVID, who during that period from December the 15th to the last day of January, that was the envelope for the big Omicron upswing, had the flu, or I was sick 5 days and I felt like crap, didn't get tested. I said, well, if you're that sick between December 15th and the end of January, you had Omicron. No, I don't think so. I wasn't that sick. Those 6 patients all have antibodies. Now, nobody ever measured their antibodies before they got sick this time, but they haven't been immunized and they have not had COVID. So I think that sick people is just like this.
Hey, you know what? I can be number 7. And I can publicly say this because, like I said, I mean, I'm not violating any secrets here as my own health, but right as we got into January, I got very.
Well, that's between December 15th and January 31st.
Yes.
And I think last week we told you to stop at Ray's office last week and get antibodies tested, didn't we?
So I can get on that list, and I see what you're saying.
Go get yourself some antibody tests, and that way you can travel to Italy.
Okay. I'm thinking that.
Well, you can go to Alpharetta or something. Hey, you can go all the way down to Brunswick to one of these political meetings. Anyway.
I see what you're saying.
Okay. So anyway, I believe that this is the government's get out of jail free card to the governors of states to say, pull the mask mandate from the kids, open up, but rather than just pounding on the go get your third shot, your fourth shot, or your first shot.
Let me say this,
because they know. I think the people that are going to get immunized are immunized now.
All right, we gotta get over to the panel, but I want to ask something.
All right.
So we always say what bothers me here is the confusing messages that we get as the Americans. So this past week I watch all the networks, and I hear a report that Pfizer and Moderna are working on a vaccine for the entire COVID world, everything that'll cover everything. Okay.
Until the next variant.
But that's what they're working on. Supposedly, this new vaccine that they're working on would protect us from any variant
that we know so far.
Right, but that's what they're saying.
Right.
That's how it's reported. All right. So that would leave some people saying, okay, well, why are we taking this old school vaccine? So that's one. Second, I'm going to say Pfizer. You can check this. But Pfizer has delayed asking the FDA for approval for infants to be vaccinated due to necessary more study. I'll put it like that.
I don't think they ought to be vaccinating infants anyway.
But you understand what I'm saying?
Yeah.
And that's where on this show from day one, right here, we were in Circuit World when you, Ray, and we had Dr. Marlowe on the phone. This is the beginning, like in March of that year.
Yeah, March
right?
of 2020.
We've never denied COVID was real.
Right.
We never denied it.
No.
We weren't deniers. But even to this day, the information that was given to the American people.
Well, I will say, I'm not going to try and say it was evil or it was wrong. It was confusing. Confusing is a good word, and inconsistency is a good word. So anybody, even Fauci himself, would have to say that the advice has been confusing and inconsistent.
I always know when I look at the clock, I got to get you to work.
Okay, what's that number?
6.6.
Okay, so the positive rate which was 1% or below in July, peaked at 22. It was like 17, then 14. I says it's going to be below 10 last week, didn't I? 6.6. I think next week it'll be below 5. And when it's below 5, the epidemic is considered gone, right?
Mm-hmm.
Okay, how many deaths have we had in Fannin County in the last week?
I'm not for sure. I mean,
one.
We have one.
How many had we had the previous 3 weeks?
0.
None.
0.
Okay. So the 7-day average for cases is 6. But on the 16th, which was 2 days ago, they had 5 at 5. Well, so you had a spike. But they're getting 6 positive tests a week. And as infectious as this has been, that number's way down. And there's been 1 death in the last 3 weeks, so we're now up to 133.
Well, you probably cannot say this, but in the 1 death, what are all the details in that?
Well,
death?
that patient probably been in the hospital for 6 weeks.
Right.
It goes way back to ground zero. And I have a patient that died a few days ago that has severe lung disease, was on oxygen at home, and has heart disease. All right? He got COVID, he went to the hospital, and he died. Well, my wife says, you can't call that a COVID death. I say, yes, you can, because he's at home, stable, with heart disease and an oxygen requirement, and COVID took him out. In past years, we would have said influenza took him out, or pneumonia took him out.
Right, I understand
or
that.
urinary tract infection took
Right.
him out. He was just weak to start with.
Right.
So these deaths here are not high school football players.
So a lot of times, and we got to close up, but a lot of times, senior citizens that are struggling with other things, a doctor will say, this winter you get pneumonia. That it could
You're
be
gone. All right.
right. You could be going.
Take your flu shot there.
Right. So what you're saying is, this is just one more thing that could take you out.
Yeah, let me give you my quick example again, and that is if you go to the circus, and there's that guy juggling 3 balls, remember?
Mm-hmm.
And he's got an assistant that throws him 4, 5, 6, and 7. He's juggling 7 balls, but when he gets 1 more ball that he can juggle, he doesn't drop 1 ball.
All
He
of
drops
them.
them all. So when you've got COPD on oxygen, congestive heart failure, renal failure, you're old, you're malnourished, that's a lot of balls. The COVID ball is just enough to do you in.
It's that last one they all.
That's right.
Got
But it's that ball is the COVID ball. And I think that's a good analogy.
Dr. Whaley, I can't thank you enough. Georgia Cancer Specialist, Northside Hospital, affiliated with Cancer Institute. Yes, my good friend here. We're running a little long. We always do,
are now.
but we always have to get him to work.
We got it.
We don't
Maybe
know
that
when.
work's only the
We
top
don't
of the
know
hill.
when he's going to quit. He'll go away for a weekend, but we got to get him to work. It's at the top of the hill. You go to work. All-star political panel right after this.